Okay, good afternoon, and we have some more numbers to share with you, how the things and issues are changing day by day. And so, as we said, this week is an important one to understand how we're being impacted with all the people having and coming back into Canada, as well as some of the early things with the school closures and different timelines in there that I'm going to talk about in a moment. But before I get to that, I'm going to ask Dr. Yaffe to give us the numbers for today on that basis. So over to you, Dr. Yaffe.
Okay, thank you very much. So as of this morning, we have 858 lab-confirmed cases of COVID-19 in Ontario. This is an increase of 170 cases since yesterday. And we now have a total of 15 deaths, unfortunately. This is an additional 6 since we last spoke, 1 in Ottawa, 3 in Toronto, and 2 in Durham region. Of the cases that have had their public health investigation completed, exposure information is still missing for about 38% of cases. Where we do know, 60% had traveled in the 14 days prior to becoming ill. 15% had a close contact with a confirmed case. 25% had neither a history of travel or contact with a confirmed case, so they were likely acquired in the community through community transmission. And again, of those who traveled outside of Canada, the United States and Europe remain the most popular destinations. To date, since January 15th, we have had a total of 80 people hospitalized. Currently, as of today, 29 people are in hospital with 29 people are actually in ICU with COVID-19, which is an increase of 12 from yesterday. And of those 29, 20 are on ventilators or intubated for assistance with their breathing. Thank you.
Okay, so if we look at the international numbers, and the ones that are most concerning to us are the ones with our neighbors to the south, whose numbers keep escalating rapidly. They're up to over 68,000, and with over 1,000 deaths already, unfortunately. And our numbers in Canada across the country are going up quickly. Our neighbors to the east of us, Quebec, are experiencing considerable growth in numbers. And as you heard from Dr. Yaffe, so are we, with now 170 reported today. And I think part of that, is that, what does that mean as far as our information? And we've been following this along in that. And I think it's important to note that with the travel, with our social distancing, with our physical separation aspects, remember we started those about 2 weeks ago today with the announcement of the schools closing beyond the March break, people told not to travel, and people making decisions then to not go on the March break. At the same time, on that weekend following that announcement, people started to return, having been away in ever-increasing numbers, and especially escalated during the week starting on Monday the 16th and growing in that time. As I said back then, our concern is what would this week show us? Last week and this week, which is another 14-day, we'll finish our fifth 14-day section at the end of this weekend. And we wanted to see what did that mean and how these numbers. And right now we're seeing those starting to rise. Went up to 100 yesterday. We're up to 170 today. Some may say, well, that's due to lab backlog. But in essence, with the lab numbers, we didn't increase reduce our backlog considerably, because we're still spending some of our main lab time to get the new labs qualified up and to do some parallel testing. So that does reduce our capacity for a few days while we wait to get those ones up and running. And I'm pleased to say some of those have already picked up the pace there And from 900, they're up over 1,100 of the outside ones, outside of Public Health Ontario laboratories. So that gives us a promise of heading towards the 3,000 up to the 5,000 that we would like to achieve at least by the end of this week. So why is that important? I think if you look at the timelines, I think that's important for us to understand as Ontarians. If the numbers are rising today, knowing that they came in last night, and the average time of production, if you take short and long term, because some are a priority, is about 2 to 3 days. That takes you back from basically the 25th to the 21st, 22nd. And then knowing that people don't come in the instant they get symptomatic, it's maybe a day or two. So that takes you back to the 19th or 20th. And then if you talk about the time that they came in, usually by the rules then, you're asymptomatic. That means you came in and then you incubated, and you could have been incubating already, but you're asymptomatic. And that means you go back another 4 or 5 or 6 days, which takes you about late in the weekend and into 16th and 17th. We're starting to see that number ramp up. And that's why this is a critical time for the social distancing, physical distancing, for the emergency order to come in, for the schools to close, and for stronger and stronger recommendations to limit travel. And further, as you heard last night and was ratified in more documents today, the new federal order to have a quarantine order, that means a quarantine law, that not only symptomatic people have to quarantine for 14 days, but asymptomatic people coming back into Canada have to quarantine for 14 days. And they're talking about different ways they might monitor and enforce that from the federal level. And they're trying to look at how we might do that and work in partnership at the provincial level. Those are not yet determined. We haven't had those discussions in specific for Ontario at this time. So well, we see that the numbers are dropping, people coming because they've either have returned or attempting still to return. And there's still, requesting Canadians, if you're out, try to get back, and the government's trying to deal with those issues as they arise, as a number of flights globally are closing down. And that means, of course, with our border crossings, rail and by water, are all going to be under the same order. So if you think about that, it's not surprising that we're going to see our numbers rising right now, because the number of people that were starting to come back in to Canada started to rise over the weekend after the 12th and 13th, when the school closures and people were canceling March break. And we knew that more and more came back during the week of the 16th up until this past weekend. So it would not be surprising to me to see our numbers in the next few days go up again, just because we have two things that could impact that. One is more and more people had been coming back and were potentially incubating and becoming symptomatic in their mid-time. And at the same time, our lab testing capabilities may start to ramp up even further, and we may make headway on the backlog. So those two together, it wouldn't surprise me to see our numbers go well over 200 in a day. And this is why this week was an important week to watch, and why we have to continue to do our distancing and social distancing throughout this week into the weekend, and why we did close the schools not only for this week, but for the coming week, because we're still in this very critical time, and we want to see how does the next 4 or 5 days go as we start to rise up that curve of the number of positive cases being identified through our assessment centers and present themselves. And of course, the outcrop of that, as there's more and more being identified positive and more reaching that peak time of incubation, unfortunately, there's some in that group, a percentage, usually about 6%, that have enough illness they have to be hospitalized. And as Dr. Yaffe said, the number that are in the hospital is going up, and the number in the intensive care unit, and most of those on ventilator, is also going up. And the sad part of it all is that we're seeing more deaths in that. And while most of our deaths are over the age of 70, we have 2 under the age of 70. And that is concerning, especially some that don't have a travel or a definite contact history that requires much more investigation to determine the cause there. So all those are symbols or are signs of that we are in this upsweep time, and that's why this week, as I said before, is a critical week. And we're only on Wednesday, I should say, Thursday. Time flies. And Thursday, and we got to wait till we get to the weekend. So my main message is to stay at home. Stay focused on what your distancing is and that aspect there. Stay healthy. Stay the course. And this is a course. And I think together, I still feel confidently that we can stay the growth and track of COVID-19 in Ontario, because I still feel confident that Ontarians are taking this very seriously and are doing it diligently in there. And furthermore, with those coming back, we are really requesting you to adhere to the new federal orders. So we're serious about that because we do not need that coming into our community and being spread around. But by doing your part, then you're of no hazard to the rest of the Canadian citizens who have been working at this now, some for 7 to 10 days already. And of course, not a hazard to your family members, and especially some who might be vulnerable due to age or other health conditions. So those are my general comments today. And with that, we'll take questions.
Okay, we'll take our question from our first caller.
Question comes from Antonella Ratuso of the Toronto Sun. Please go ahead. Thank you. Good afternoon, doctors. Can you hear me?
Yes, we can. Thank you.
Thank you. There was a report that an inmate went to a Toronto South Correctional Facility this week. He was a presumptive case. The local officials say that they were able to keep him in isolation. But I'm wondering if you can provide any update to that situation, and do you have any concerns about a possible COVID outbreak in correctional facilities given sort of the physical space?
Dr. Yaffe?
I can speak to that. Yes, I'm familiar with that situation. Toronto Public Health had identified this individual as a presumptive case. So when he was transferred to the correctional facility, it was done with all the appropriate infection prevention and control measures in place and placed in isolation. And it's a confirmed case, but given that all the appropriate measures were taken, there is no risk of spread from that individual in the facility.
Follow-up?
Yes, there was another case at a grocery store in Oshawa. It was in the media. Obviously, a lot of people are going through the grocery stores. You're seeing lots of plastic gloves being used to handle grocery carts. They're being thrown in the parking lot. Are you still satisfied that grocery stores can provide a safe atmosphere for people? Do they need to go to these lengths to stay safe?
Well, I think the whole aspect of maintaining these essential services for our public who are wanting to stay home and keep up the social, physical distancing is a critical part. I think the stores are doing all they can to protect, first of all, their tellers and their staff, and always reviewing to see what else they could do to make sure, because you have to do some things new that you hadn't been doing historically in the day-to-day function of your operation, and it's a different way of carrying on business. And that does take some time, and some people, just like we talked about before, when you learn not to keep touching your face, I'm trying to still work at that, excuse me, and you practice that. The gloves, I think it's an interesting point. If people are taking and throwing stuff casually out around in garbage, that does concern me. It concerns me anytime. I think people in the public, if you're doing that, you need to find the proper receptacles and put them in there, because that's part of your due diligence in carrying out your protection methods. So if you're using protective equipment and disposing of it, you need to dispose of it properly, much like you do the same with your hand hygiene and hand washing. So it concerns me with the grocery stores that people, one, listen to what the retailer is asking you to do. That means distancing. Take your turn to come in the facility. Respect the distancing from the teller. If there's a plastic barrier there, don't keep leaning forward and hitting your head on it. Like I've seen that happen a few times. And practice the distancing, the two-step in a way. Put your things on the counter, step back a bit, let the teller handle those materials and check them. Usually they're wearing gloves. And then when they finish bagging and that, then they tell you and you step forward, they step back and they do their You do your payment, usually electronics better, but cash can be handled with gloves and that, and then you just honor that. So I think there's a lot to be learned from all of us. This is a new way of doing life for the next while, and people, I think, are adapting. They're getting with it, and I see it happening, but it doesn't mean everybody's got it down pat yet.
Next question.
Next question comes from Alison Martel of Reuters. Please go ahead.
Thank you. Dr. Williams, there seems to be an emerging school of thought that testing very broadly, including everyone with relevant symptoms and everyone who's had contact with a case, even if asymptomatic, would make it possible to find and break all chains of transmission and get this under control. I recognize this is not possible in Ontario right now, but it also doesn't seem to be something we're working towards. Can you help me understand why that is? Do you feel that asymptomatic spread is not a significant issue? Do you feel that this will never be feasible? Or is this something else?
Well, that's a matter we've had lots of discussions about, because most of the time we feel when people are symptomatic, they're usually have had the medical term, the virus has duplicated enough or replicated, it's spread in their blood system, and they have enough of a viral load that if they're sneezing or coughing or in their saliva, they're spreading the virus. Some people are asymptomatic. I mean, you can do a swab and you find it could be dead particles of the organism in the back of their nose. They may never get symptomatic because they may have been so mild they already got rid of it. So finding out if they have live or active infection is a challenging one, but one wants to be precautionary in that basis there. So I think one aspect of why we've implemented it, if we thought it was only do that contact case only with close contact, as we start out with, we would have been not so eager to carry out the extensive social and public health measures, such as the distancing. Because if everybody's distancing, it doesn't matter if you're asymptomatic or symptomatic, the chance of spread is zero if you're doing it, honoring it, and doing your hand hygiene and all those other methods. So it covers up for that. The wide testing of everybody all the time, because you may find if I've been somewhere and I have maybe some small viruses in the back of my nose, I'm not symptomatic. You swab me, you miss it, I'm negative. Within about 6 or 8 hours, it starts replicating. I become positive again. I'm under the pretense that I'm fine. I can do whatever I want. That would be a false assumption. So I think one has to be careful when you're doing population screening of asymptomatic people to not give a conclusion that that person now has no problems at all. And we often get that where someone who has been traveling and wants to go back to work earlier before the 14 days, a negative swab tells you that at that moment they're negative. It doesn't tell you if they're not incubating or could become positive. So we really don't recommend that. We'd rather you do your 14 days. That's the same thinking. I'm not sure if does that answer your question?
Not quite. I mean, we're seeing some research now, and I confess I haven't gone back to read the paper, and I should, but suggesting that there are asymptomatic people with pretty high viral titers. And, obviously we're all social distancing, but some of those people could be going to the grocery store, could be walking by their neighbors in the hall. Are we ever going to look for them?
So it'd be interesting to know when you said they had high viral titers, because that's a quantitative test. Usually we don't have that in our current testing methodology, and we're not doing cultures. So I'd have to see the study to see how they estimated that. But what does concern us that sometimes we'll see tests where people are quite ill, and especially if their immunity is low, they could have quite a large load, especially in their upper respiratory nasopharyngeal passages, and that's why we're so concerned people coughing, sneezing, and droplets spread on people around, because the droplets then are more likely to be laden with the virus and live virus. So we haven't seen that in any studies I've seen with the asymptomatic. We found some that have positive PCR testing, and then we can't tell whether it's live or dead on that. And again, that PCR testing in the ones I've seen tend to be more presence, absence with some level, but not really totally quantitative.
I'm wondering if I could try and add to that. Generally speaking, the more symptomatic the individual is, the more infectious they are to others. It's not to say asymptomatic people are not infectious. Obviously, we have learned that they may be. When you said they have a higher titer, to me, titer usually is regarding antibodies, which is a serological test we don't do currently in Canada. I believe the UK has just implemented, and that's more to see if somebody has been infected and have they recovered. We talk about viral load, and the viral load tends to be related to how symptomatic someone is. But while we're talking about testing, I want to clarify a point that's been a point of confusion for some people. We are recommending that people who are symptomatic be considered for testing. The decision whether they're tested or not is a decision by the clinician, the doctor or nurse practitioner who sees them. We do have priority groups, but they are not the only people who can get testing. So I just wanted to clarify that.
Okay, that was your follow-up. So next question.
Next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hello, doctors. Just wondering, some organizations are extending their closures out a few more weeks. For example, the CN Tower has said it won't open until May 30th. What can you tell people about how long they're going to have to keep, staying in the house as much as they can and doing the social distancing? Is this going to be at least 2 more months?
Well, that's the question everybody's asking, and that's one reason why I wanted to see what happened this week. If we happen to then coast through this week and stay down low, I would be surprised, pleasantly surprised, but we're not seeing that. The numbers are going up, and I think until we see that peaking and leveling or coming down, we're going to have to keep the levels of precautions in place. How long will that be? We have to wait to see how the end of this week goes and perhaps into early next week. That's why some who are planning to open by April the 5th have decided to defer. And these are decisions we're going to have to make in systems and otherwise to see if we have to maintain the social distancing in order to try to bring, and as you talked about, flatten the curve and ideally even make it even lower than that if we can. So we are going to watch the numbers. And as I said, we went from lower to 100, 170, and let's see what Friday and the weekend brings. But I said before, with the two things combined, it would not surprise me to see the numbers climb over 200 in a day with the flow of people and with the lab backlog starting to be addressed as all the other labs are picking up and doing their responsibilities.
Follow-up?
Quick follow-up maybe with Dr. Yaffe. I didn't catch the number of people who are in hospital now today. I got the ICU breakdown.
Yeah, we'll have to get back to you with the specific number. I only have the number that have been hospitalized to date, which is a cumulative number.
Next question.
Next question comes from Alison Jones of the Canadian Press. Please go ahead.
Hi, Dr. Yaffe. I'm hoping you can just clarify. You said off the top there were either 15 or 16 deaths. I didn't quite hear. And on the website update this morning, it said 13. So can you tell us the ages and regions of those new cases since this morning's update?
Sure. So I'm aware at this point of 15 deaths. And that is 6 more than we had yesterday. One in Ottawa, which is a man in his 90s who was living in the community. 3 in Toronto. 2 of them were residents of Seven Oaks nursing home, which was having an outbreak. I'm not sure about the third one. 2 in Durham region. 1, a man in his 80s who had recently traveled outside of Canada, and 1, a man in his late 40s who the health unit is still investigating, but at this point there's no history of travel.
Follow-up?
Yeah, I'm wondering at this point, as we're seeing more and more cases, and as Dr. Williams said, we're expecting that to just keep increasing at least over the next few days, especially in places like Toronto dealing with so many active cases. How are we dealing with contact tracing these days? Are public health officials able to keep up with this?
Well, that's our question we're asking them. How are you doing? How goes the load? One we haven't announced, and we're trying to address that with our ones resolved. And we're trying to get that number ratified with our health units. We know it's going to be somewhere between 150 to 170 that have completed that. We just want to make sure that each of the health units, and of course a lot of those resolved are from Toronto. So it's not that they have the full load still on the table. They're moving them off there. We're trying to look at models to make sure we can enhance the public health infrastructure quickly to make sure they have the person power to do all the contact tracing, the phone calls, and other aspects that the public who are either had travel history or contact history, use the self-assessment tool, may have contacted telehealth, may have been tested in an assessment center, but staying home and isolating, will have timely and quality contact from their local health unit, be it Toronto or the ones around the Toronto area, or we've had some more and more health units experience their first cases throughout the province. And so they would do that in such a way that the people who are involved in the self-isolation would feel supported, would be able to get their questions answered. And if they're in a case positive where they are supposed to be doing isolation and not going out, if they need something and they feel it's urgently necessary, they could ask for assistance and help to acquire that so they don't feel pressured to go out against the isolation and, in the other case, the new federal law, quarantine orders to maintain that. So that's a new entity we have to deal with the people who are asymptomatic, return from outside, and are in quarantine, not just isolation. So these are more challenges for us in how we're going to implement that to support that. It's not meant to be punitive, it's meant to be preventative and caring, and therefore how do we help those people to do that, what the order has asked them to do, so they would do it diligently and consistently, and therefore we need the public health infrastructure to ensure that that type of continuity, connectivity, communication is timely, empathetic, sympathetic, as well as functional, and enough that we can get the data collection and to keep a full appraisal of how it's going in each of the respective health units. So it's a constant, it's a dynamic discussion. We're doing summer meeting today to talk about that. We want to move quickly on that. So it's a good question, and we want that answered quickly.
Next question.
Next question comes from Mike Crowley of CBC News. Please go ahead.
All right. Sorry, can you hear me, guys?
Yes, we can.
Hi. So, Dr. Williams, do you have in your mind a date of if you don't start to see the number of new cases drop by then, that you start to get worried?
Well, if you extrapolate on what I was saying, that we're now seeing the end of that first weekend after the school closure. So when we started, if you look at what the public health measures were, Mike, in there, we started with the schools on the 12th announcing they're going to close for 2 weeks. People asked not to take the March break. Employers asking employees, especially in the health sector and essential services, to not go traveling in that. And then people started changing their plans in that weekend of the 14th and 15th of March. And then we brought in the emergency order on the Tuesday. And other people began to realize that the need to get back into Canada was picking up. More and more were returning. As we said, that week, we had about 1 million people come back in that time to Canada. So more and more were coming as the borders and different aspects were closing. Flights were closing internationally. And so one would have to ask the question, when are we convinced that nearly 9.8 tenths of all the travel inflow into the Toronto, into the Ontario area has come to a halt? And I know it's ramping down. We're trying to get some borderland security data to see how effective that is, and now with the new quarantine orders. So if that's walled off and everybody maintains the distancing in the new insert from that period on for the period of the 14 plus days, one would expect to say, depend on how successful the public health measure, and that's why it's so critical. If everybody's what they're supposed to do, then the virus doesn't transmit. It can't go anywhere, and it doesn't spread. So it's really a test of saying, how well did the public health measures work? How well did everybody do? It's like everybody's report card. How did we do? And if we look at those windows there, by the end, like this, most of the travel will have ended, I think, extensively by the end of this week. And then, so we're still looking at some period there. But even the end of this week, it's dropping off. And the number of people coming back are getting less and less, and are being asked to be more and more restricted in their social activities. So, as I said, this week was going to tell me how the impact of the traveling public was going to hit Ontario, and it seems to be significant already. I don't think we've finished that yet. The next week after this one, we'll start to give us some early measures. Are our public health measures and social distancing, physical distancing, etc., are they starting to make an impact to what we call flatten the curve? And so we're going to be paying a lot of attention to those numbers this week and into next week. One this week to see the impact of the travel, which will ramp up pretty high going into early next week. And then we may start to see if our social public health measures, if we're starting to flatten the curve.
Follow-up?
Okay, I didn't hear an actual date in there, but I'm thinking from what you said, it's that if there isn't a reduction in new cases by, say, the end of next week, first, second, 3rd of April, then maybe we should start to worry. But my follow-up question is actually about the lab testing. What is the real main reason why there are so few, relatively speaking, lab tests being done? Is it staffing? Is it this lack of reagent that the Premier mentioned? Is it just that you haven't been able to get enough facilities online? Like, what's the real reason why the lab testing hasn't been ramped up to the extent that you're aiming to?
Well, when we're doing this, as we're opening up 8 or 9 new labs, so the public health laboratory does about 1,900 in a day. And earlier, the labs outside of Public Health Ontario were doing between 8 to 900. And so that gives us potentially around 2,700. One time last week, we got close to 3,000, and we were hoping to get to 3,000 this week. Part of the challenge, I understand it, is the two things. From the Public Health Laboratory's purposes, is that every time you open up a new lab, the first 50 samples of all those new ones have to be repeat tested at Public Health Ontario. So the challenge of opening up new ones is that slows down and takes away from the capacity of your central one. But that's an investment, because once they're up and cleared and the quality is assured, then those other ones can go not only to 50 a day, up to 100 or 200 a day. So it's part of that early investment that they're in the thick of this week right now. The other aspect is that you're getting more and more patients admitted to the hospital, more and more being seen in the emergency department, that then not only have one sample, but they submit 2 and sometimes 3 samples, and on a priority basis, they have to be done. And so that takes away, instead of just one test, it takes away 2 or 3, so that can impact another 100 to 200 tests capacity of their central lab. So they're being pressured on different sides. So we're hoping as these ones get certified and are off and running, if you may, as we're already seeing that the ones outside of PHL have moved from 700 to 800 to 900 to nearly 1,200 yesterday. It's showing the investment and the ramping up. And then once they're up and going, then the Public Health Laboratory can go back and do its more full capacity of new people coming in or working on the backlog of the 10,000 plus cases.
Next question.
Next question comes from Althea Raj from HuffPost Canada. Please go ahead.
Hi, thanks. This morning, Dr. Tam told Canadians basically that if they have concerns about their friends or neighbors not abiding by the mandatory quarantine, that they should warn local public health agencies. Now, my understanding is that these people are already overwhelmed. So is your recommendation that if they're concerned that people are not respecting the law, they should also call public health?
Well, I didn't see Dr. Tan's announcement. As I said, they just announced the new order yesterday, and our special advisory committee was on this afternoon outlining some of the details of how they thought they're going to implement that, especially from the federal authority. They had mostly function in there related to their officers, such as peace officers and border guards, as well as RCMP. And they didn't have any direct requests to have provincial responsibilities outlined yet. So I think that that discussion is yet to happen. How we might do that? I think there's no doubt that people have reported what they call already large gatherings that they think are inappropriate in parks and stuff, and you've seen Toronto take some steps already to stop that. And so that's useful. I think I'm hoping that the people coming back will want to do it the Canadian way, and that means civil responsibility and take it seriously. I'm not sure we're out there to spy on everybody, but if there's something that helps us to maintain things, we'll have to look at that. So I haven't put out any edict yet to tell people to call local public health, because you alluded to right at the moment they're busy dealing with case and contact management. As I said, we're hoping to ramp that up considerably in the next week to see if we can rise to the task, the ongoing challenge of these ever-increasing numbers. So I can't say that I've agreed to that yet, but again, we only heard about their rollout this afternoon, and more discussions are required.
Follow up?
So would you, from what I'm gathering and what you're saying about the cases that have already been reported to the police, is that your preference, that if you are really concerned and you think somebody's not respecting the law, that you should call the cops?
How they do that in each jurisdiction, that was something I think that how the mayor of Toronto was informed on the issue. I'm not really sure, but he asked his police authorities and neighborhood police to cordon off those areas and to ensure that they're not being used in that way. So that was a decision by the Toronto mayor and the police department in that thing. All our different municipalities in Ontario, we have different. We have municipal police forces and we have OPP. Ontario Provincial Police, so it's different in different jurisdictions. I'd say as a province, we haven't made a decision yet how we might undertake to do that in conjunction with the federal order.
Next question.
Next question comes from Phil Perkins at CHCH. Please go ahead.
Good afternoon, doctors. Just wondering, you're mentioning that 25% of our new cases are from community spread. Is that discouraging? Does that mean that the people who have returned from travel aren't abiding by the rules?
Well, actually, just to be clear, it was 25% of the cases that have been investigated by public health. So that's roughly 60% of the cases. So it's 25% of 60%, which I guess off the top of my head is 15%. Anyway, and I think this is of concern. To me, it tells me that within the capabilities of the public health unit investigations, they haven't been able to determine where this person got it. So to me, this is evidence of community transmission. Is it community-wide? No. What it's saying is there has been some transmission, and people should know that it's very important to keep the social distancing. I mean, all of us have to do this. And if you stay home, obviously, if you can't stay home, social distance, because as someone alluded to before, even people who are asymptomatic may be infectious. So you have to really think about everything you're doing right now.
Follow up?
In that case, for those groups of people, is it possible to find out where they've been, and so we can make that public information so that maybe people can backtrack on their own and have a better idea of what situation they might be in?
I think those are decisions by the local health unit as part of their investigation. If they determine, and it's a very important part of their investigation to do contact follow-up, and determine where was this person for the period they might have been infectious, and did they expose anybody? Were they close to anybody for, within the 2 meters for any period of time, not just walking by, but 15 minutes or more, or something like that, and then notifying those people. So, and telling them, you might have been exposed to this. You should be watching for symptoms, self-isolating for 14 days. And so that is done. But in terms of following exactly where everybody's been, that is not going to produce any useful results for anybody. Because we're all walking, unless you're at home, you're walking around, I take the TTC still, and everybody's pretty good about being respectful and keeping that distance.
Next question.
Your last question comes from Miranda Entwistle from Global News. Please go ahead.
Hi there, doctor. Thank you for taking my question. Apologies, I joined a little late, so I'm not sure if this was already asked, but I was hearing in Durham that the young person has passed away in his 30s, and he was...
I'm sorry, we're having trouble hearing you. It's very unclear. Could you repeat it? Maybe use a handset? It's not very clear at the moment.
My apologies. Is this better?
Oh, yes, thank you.
Sorry about that. So we're hearing in Durham, the latest patient who passed away, a man in his 40s, worked at a local superstore. Are you able to confirm this?
That is the information I have, yes.
Okay, thank you so much.
Follow up?
And I guess any more details in terms of you reaching out to people? Is this something that's being done right now? People at the superstore, people who have passed through there, are they being notified?
That's something that the local health unit would be working on right now. You'd have to speak to them.
Okay, I think that's all for today. Thank you.
Thank you.